may see them once or twice and that's it. But say you get a referral and the person has just seen the doctor and the doctor's diagnosed them with carpal tunnel syndrome, and so they come to your clinic, and a couple of the tests that the doctor should have already done, but you can do as well. And sorry, my fingers are cold. So you would do the phalanx, and you put your wrists together and press. I think you do that for 30 seconds, right? And if they feel any numbness or tingling in the median nerve distribution, which is these two fingers and the radial side of the ring finger, then that's positive carpal tunnel. And then you do the reverse phalanx, and that's the same thing. You hold it for 30, I can't remember if it's 30 seconds or a minute, but we want to see if we're producing those median nerve compression symptoms. And then the tenils is if you tap along the median nerve, do you get that tingling in your fingers? So what people first notice about carpal tunnel is that they wake up at night and their fingers are tingling or they have pain in their wrist. And then if they sort of ignore it and let it go on, then they may start having those symptoms during the day as well. And I've had a few patients that knew they had carpal tunnel but didn't have insurance, and so they went 2 or 3 years with those symptoms, and at that point their finger muscles atrophy, and so they're not ever going to get full function back of their hand. So most doctors will send them to therapy for 6 to 8 weeks, see if we can get all the symptoms resolved, and then they won't have to have surgery. But if they still have symptoms after they go to therapy for a few weeks, then they go ahead and have the surgery. And so pre-surgery, you want to do things like first make them a splint at 0 or at the most 15 degrees of wrist extension, and that puts the median nerve in the least compressed position in the carpal tunnel, right? And so the advice is for them to wear this at night to relieve the symptoms. It depends on the patient. If they have symptoms all the time, I'll have them wear the brace all the time. Or if they're doing something that they know is going to aggravate the wrist, like driving or doing something that involves gripping, especially with vibration, then they'll want to wear the splint. So we see carpal tunnel a lot with factory workers, the musicians, anything where they're involved with vibration, cold, repetition. We see it in pregnant women because their blood volume increases, and the carpal tunnel is pretty small and you have all those structures going through there. And women have Caucasian and Asian women have generally smaller carpal tunnels than everybody else. I mean, you can see it in other people. I remember a big guy that had just started a job where he was, he worked in a factory at night, and he used a hose to wash all the floors. And the way the hose was designed, he had to hold this lever down and hold this hose where the water was coming through with a lot of force. And he got severe carpal tunnel in both of his wrists within 2 weeks. So the tool was not designed with someone using it for several hours at a time, and eventually they have to find a business has to find a different hose that works differently, or they're just going to have successive workers end up with severe carpal tunnel. All right, so definitely you would do centimeter measurements for swelling with the carpal tunnel. You could do the quick dash, which we haven't done yet. The quick dash is 11 questions. It's a self-questionnaire that they fill out and check, and it's basically, how well can you do these things, and it's a 5-point library system. Often the quick dash is used on the initial visit and every fourth visit, track of how well they're progressing in their therapy or not. In terms of the modalities, with pregnant women, I like to do hot cold baths. They tolerate that well. You can use just the cold pack to reduce the swelling. And I also like to, did y'all find the isotoner glove? I saw it down last week. It's like, oh yeah. But do y'all know what isotoner glove is? Alright. So it's a beige glove that puts some compression on the hand, so to push the swelling out of the hand. And we turn it inside out because the seams dig into their hand if you put it on the way you usually do. So turn it inside out so the seams are on the outside, and then they wear that and it just cuts down some of the swelling in the hand and at the carpal tunnel. So they may wear that to decrease the swelling. Generally, after surgery, they may be hypersensitive. About 2/3 to 3/4 of people have the endoscopic surgeries, where they just have little scars, but some of them, their carpal tunnel is so severe that they end up with having a fairly long scar, and that can be sensitive. So we often use the fluidotherapy for hypersensitivity of a scar. Any scar with your conditions, you can do scar massage. And so scar massage, you sort of, there's 3 different ways to do it. You can massage like side to side. You can massage up and down, and you can massage in circles. But you're trying to break up those collagen fibers that are forming. So you can teach the patient how to do their own scar massage to break up those collagen fibers. There are other things you can do. There's a silicone gel sheet that you can put inside the isotoner glove over the scar. It helps the scar mature and lay flat. There are 2 other products. One's called Otoform, one's called Elastomere, and they're basically like a putty, and you mix it with a catalyst, and it ends up being something like this. So if I had someone with a carpal tunnel scar, I might make them something like this, or put a silicone gel sheet there under their isotoner glove, and it helps that scar as it matures lay flat and not bind down to the tendons and nerves underneath the scar. So again, after the surgery, with carpal tunnel, it's important for you to teach them both tendon and nerve gliding exercises, because when a scar heals, it heals like a block of concrete. And so, since the tendons and the nerve are so superficial here, you don't want those to get down in the scar. So this is on the Google Doc, the tendon gliding exercises. So after the surgery, you want to teach them how to do tendon gliding exercises. And so the first thing is you would do a ball like this, and then you would roll it down like this, and then you would do a duck, and then you would come down like that. So that helps the tendon glide through the carpal tunnel. And then the nerve gliding is you start with a fist, and then you straighten out your fingers all the way, and then you bring your wrist back. There you go, and then you bring your thumb out, and then you bend your elbow if it's not already bent. All right, and then you pull on your thumb with the other hand. All right. So as part of your home program, you might want to have tendon and nerve gliding exercises. As you show the patient, you can refer to them, and then that's part of your home program. Also, let's go back to pre-surgery. So there was an article written by some therapists in Texas, I believe, that have really good cure rates for working with people who have carpal tunnel, so that they don't have to have surgery, and they do myofascial release techniques on them. And to give you an idea, I'm not going to show you everything they do, but they sort of try to help widen the carpal tunnel by like taking their thumbs and like repeatedly sort of moving the tissues to both sides. So that's sort of like part of what myofascial release they would do. So they're trying to like widen that space so that all the structures can go through and the person not have to have the carpal tunnel surgery. Other things that you could do pre-surgery, just stretching exercises, showing the patient how to do stretching exercises so that they're increasing their ability to extend their wrist and flex their wrist without triggering their carpal tunnel symptoms.
You've got about 3 minutes.
Okay. And then, depending on what kind of work they do, we see some of the people that I saw with carpal tunnel ultrasound technicians, because they use the head of the ultrasound all day in awkward positions with their wrist. Dentists and dental assistants, musicians, carpenters, plumbers, so people that have to use tools with their wrist either flexed all the way or extended all the way and gripped, often put pressure on a carpal tunnel. So one of the things that you talk with them about is, what movements they do a lot at work, and you also see this oftentimes is if you're working with one hand that they've had carpal tunnel surgery on, and or if you're in a splint, then they're overworking the other hand. So while this hand gets better, the other hand gets carpal tunnel. So I also see it a lot when people have rheumatoid arthritis. So we talk about teaching them how to know when to apply ice, when to rest their hands, how much they should wear their splint during the day, and adaptive equipment so that they're not gripping so hard in their job. Or musicians, the factors that figure into carpal tunnel are repetition, vibration, cold, and musicians often play in a cold room and they're doing the same movements over and over depending on what instrument they play. And they don't often have very good body mechanics doing those positions. And so when I worked in hand therapy, we had this school of music down the block. And so we ended up seeing quite a few musicians that had developed bad habits in how they play and held their instruments, and so we worked with them on finding better positioning with that. And so any job, it's about adapting the tools, better positioning of their body, and especially their wrist and hands, to find some relief from those repetitive behaviors impacting the carpal tunnel. All right, make sure you use your article and home program for that. Anything, you can use the fluidotherapy after surgery if you want to desensitize the scar. They don't usually wear splints after surgery, but oftentimes we get them a padded sort of work glove that has the fingers cut out, like a fight glove, sort of, or exercise glove, and that helps where you can put the pad to decrease the scarring, and it helps like support the wrist just a little bit, but it's not like a hard support. So generally you don't use these kind of splints after surgery, but you might use some kind of like a work glove that has padding on the wrist. All right, thank you, that's all for that one.